Okay. Can you restart that question for me?
Yeah, for sure. Um, so I'm curious, just
You
I
said
watched
you watched a video of mine from like
that
7 years ago?
from 2013 where you were talking about like it was like part one, um,
Hmm.
where you were like part one of your discovery to getting diagnosed and like your recovery. So I am 26. I like right at my half birthday, and so I'm unsure of this. How old are you? Just
I'm 31.
31. Okay. Because for me, I feel like I'm pretty, I don't know, lucky. And it sounds like from your story, from my understanding, kind of from your origin of when you said your diagnosis and recovery is like, I feel very fortunate that I was able to get a pretty clear diagnosis, um, 25 going on 26. Just from my understanding, like bipolar diagnosis is usually pretty delayed diagnosis. And so I'm really fortunate that it's something that was, caught within like the first 5 years of my young adulthood. So I always wonder, like, if I hadn't been interested in psychiatry and I hadn't been interested in healthcare and I didn't have that, self-awareness, like how much further along, would that have been? So I'm just curious if that's something that you've ever thought of. Or it seems like you had really good people in your life, um, for you whenever you went to the hospital. Like it seems like you had people that really recognized that for you. Um,
Yeah. Yeah, and I was very fortunate. Bipolar disorder had run in my family, so my mother specifically had known specific symptoms that I was starting to show in my manic episode when I was 22.
yeah, I used
Um,
to in the
and I also had friends that were very encouraging for me to actually go to the hospital. And it's very strange for me. I always think about like because that was really the first time I seeked out any sort of psychiatric care. Was the first time I went to the hospital, including therapists. Like I had never talked to a therapist or even my primary care doctor about any of my mental health symptoms, which I definitely had years before. It just never got to that severity. And so when I was in the hospital, it was, I think, a relatively easy diagnosis to kind of make because it was very classic mania kind of symptoms.
Mhm.
But I always think about, I was like, I wonder if I had disclosed my mental health symptoms earlier to like a primary care doctor or a therapist, like I said, would I have actually been diagnosed with depression at that time? And would that have delayed my bipolar diagnosis kind of thing? And so it's very, yeah, I don't know. It's who really knows which is better kind of thing. I would like to think I don't need to go to the hospital to get a diagnosis of bipolar disorder, but it just kind of worked out that I was in a safe environment, and I do feel very fortunate that I had health insurance and people in my corner to really help me.
Yeah.
So what was your story like? When were you diagnosed?
So for me, I've had um, psychiatric issues most of my life. I have a eating disorder history dating back to when I was 12. However, the depression, that didn't really start until I was in college and undergrad. And I am really interested in like sports psychiatry. I'm a huge into running. I did very well in my college career. Um, and I think that my participation in athletics kind of masked a lot of some of the more manic symptoms that I was having. But I had gone to like the university health services for um, like anxiety, depression. I had a lot of like depressive phases, that were just, oh, she's depressed. I was given an antidepressant, really didn't do anything for me. Um, and I I noticed when I was 19, and I remember the exact day. Like I have a very, very vivid memory. I remember the exact day where I was. Like I just felt so different. I felt so depressed. And that pattern would play itself over a few times. But in between, um, maybe months or a year later, the way it always played out for me is over the summer as a runner in college. Like you just run easy, you run a lot of miles,
Hmm.
and that for me is not very triggering at all. Like if I just run easy, I can run like 12 miles. That doesn't really trigger anything for me. But in cross country season, which is like the origin of an athlete's season for a distance runner, you start
Hmm.
doing really hard workouts, like 5 by mile at 5 30-minute mile pace, or you race a 6K for a woman. So
So you're getting
think
after it. Yeah.
and sprints and hill sprints, and you're really really amping yourself up, and you've got crazy brain chemistry going,
Hmm.
obviously, and these really hard workouts and races. And it became like, as the season would start, I would just not be able to sleep. Like I would be, it was so weird to me, like, oh my gosh, like I just raced my heart out and I'm so tired, like physically, and I just exert and I can't sleep. Like
Hmm.
by the end of the season, I would maybe get like 2 hours sleep a night. And it got to a point where I barely slept at all for like a few days. I remember once after a race, I was awake for like, I think about 3 days straight.
Wow.
Um,
And
yeah,
so were
I ran
you in?
PR. I ran like really fast during this
Oh,
time.
okay. So that was my question. I was like, in this state of kind of either hypomania or mania, whatever you want to call it, were you
Yeah.
actually performing well?
Oh God. Yeah. I was killed it.
Interesting. Okay.
I mean, the
Yeah.
physiological aspects, like I have a sports psychiatrist now, and he's like, basically, uh, it's kind of like if someone were to give you like performance enhancing drugs, it's just that yours is, legal.
Uh-huh.
Yeah, a version of something that people take, illegally to do well in sport. I mean, I ran like my mile PR, my 3K indoor race off of no sleep for 2 days straight. However, there
Wow.
was a point when I would just physically like crash. Like I still couldn't sleep, but I gave myself like very very bad neuromuscular fatigue. Like I seriously could not run 8 minute pace. Because I really think like I outdid my body, but like mentally
Hmm.
I would still be like totally awake. I was, and I always wonder if I didn't have my sport. I mean, I was running like 80 miles a week on average. Like, what if I didn't have my sport, or I didn't have something that I was able to channel all that energy into? And I think that was something that kind of really masked the effort. And I think in a lot of ways I was applauded. Like, oh my gosh, she gets up at 4 in the morning to go run 10 miles. Like, she is so dedicated. Or,
Hmm.
just like being able to do so much, and to handle a full class load and work part time. And um, yeah, I was able to handle a lot, and I was praised for that. And it was a very functional,
Hmm.
good
Student
thing.
athlete. Yeah.
It's like I
And
was running.
you were like an All American, I saw, right?
Yes, yes, yes.
Wow.
Very proud of that. Yes. Um, so yeah, I would always do really well cross country season, and I never ever ever had a good track season. I would
Okay.
always just totally fried. And I usually at some point, it's not like it was exact clockwork, but at some point I would get really, 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 really depressed. When I would feel really, really, really depressed, is usually when my bulimia would kind of
Okay.
interfere. And I think like a lot of ways that people with bipolar disorder, wherever they're on the spectrum, whatever their diagnosis is, they utilize, substance abuses. Like mine really was binging and purging, and that's what I would do. And it was just this pattern that would replay all throughout college. And it was just, oh, um, she's depressed. And whenever I was, in hindsight, having hypomania, I was just killing it
Hmm.
athletically. You know what I mean? My final year of undergrad, kind of similar, mirroring yours a little bit, is when it really started to get very problematic. I seriously, what was supposed to be my final semester, so I was 22, and it was the fall season, um, but I was exercising like 4 hours a day. Like I was like
Hmm.
running maybe 70 miles a week, but I was like swimming or biking another hour a day, like twice a day, for no reason. So like my coach, had me do this. I was just doing it, and I couldn't concentrate on anything. I was failing all my classes,
Hmm.
I had done so well in school and I was failing them. And I withdrew. And I think because it never really reached a true, manic point, I've never met criteria for bipolar type 1 or manic
Okay.
episode.
Mm-hmm.
I think it was really missed. And, the University Health Services family nurse practitioner, and this is not to slight this providers of that. It's just, I don't think it was really recognizable,
Mm-hmm.
um, because I wasn't seeing one provider, I wasn't seeing one doctor, I wasn't seeing a psychiatrist. And, I was just given an antidepressant, which I was actually too paranoid to take. But I
Oh,
picked up,
okay.
yeah.
So
And
you didn't have any of like because sometimes when people who have bipolar disorder take an antidepressant, they flip into a mania. Did that ever
that
happen to
happened,
you?
but later.
Okay.
Later. So yeah, so I just dealt with it. I didn't take the antidepressant because I was too scared, too paranoid to take it. But I didn't tell her that. But really, anyway. So
It's
I had,
common. It definitely happens. And me and you both are going to be prescribing these same medications in the future. Who knows when exactly? But it's definitely something we have to deal with. Whereas other physicians or nurse practitioners, whoever, prescribing like a blood pressure med, people hopefully it seems like typically take a lot easier than psych meds.
yeah. So yeah, I ended up graduating next semester. Uh, and then I had a lot of phases of depression. I finally decided I went back and after college, I saw my primary care doctor who had basically been my family GP my whole life,
And
prescribed some
and
anti.
this whole experience must have also impacted your athletics, right? Did you compete your senior year?
No, because I was failing my classes and I withdrew. I had lost my eligibility.
Oh,
Uh,
wow. Okay.
so yeah, so it was very tough.
Yeah.
I had a lot of difficult circumstances in undergrad. My father, who I think he likely had bipolar disorder of some kind, or he died of substance abuse. He was an alcoholic his whole
Hmm.
life,
Okay.
very
Sorry to hear that.
functioning alcoholic, but he just drank like a fish. And I mean, he held a job and he retired, but I mean, his marriage and family were horrible. Wasn't the father that I'm sure he knew he could be. But he passed away when I was 20, on hospice, and I had actually given up a Division I scholarship, to be with him in that time, and I re-enrolled at our local university, and that's where I graduated from. And so he passed away in the fall, and then about 2 weeks later, while I was running on a bike path, I was assaulted, not sexually. Like I still to this day have no idea what this man was after. He just beat me up and
Oh,
strangled me and left me in the forest. That's
that's
I
terrifying. Jeez.
I don't know if it's because I was very aggressive back. I was not submissive, and that was not. My detective thinks it was probably sexually motivated, but for whatever
Hmm.
reason. So, but no head trauma. Had a CT. That's all good. So
Yeah,
it's
but I mean, geez, PTSD trauma maybe. That's
the question of
it's
like, oh, what if she's just had a TBI this whole time? But no,
well,
it
and
was.
it's always I feel like when I go exercising, it's always something that I don't even think about and I take for granted, like because I'm a large dude. It's like, like these are things I don't think about when I go running on bike paths all the time,
Oh, I,
and it's just such a different experience, as being a woman, running on those bike
yeah.
paths.
Yeah, definitely. Yeah, I went back and I ran the same spot the next day.
Hmm.
Me, like, that was so insignificant. Like that was just like a brush off the shoulder compared to losing my father. But I mean, it
Mm.
was definitely a really tough time. So I think these events were very stressful for me in undergrad. But I think that honestly, I would still be bipolar without them. But it was a very, very stressful time in my life. My father, he drank his whole life. He was, you know, sometimes he would gamble away all of his money in our,
Hmm.
and he would make really impulsive decisions. So I think it's likely, maybe he had it, maybe it runs in my family, but um, I think
And
so.
so So when were you finally diagnosed with bipolar?
Just in this last year.
Okay.
So anyway, back to such a, I get off track here. So anyway, I'm out of undergrad and I go see my family GP who's like, okay, you have depression, put me on an SSRI, sertraline, and did okay, but I eventually ended up really, really, really depressed. Sertraline never really, an antidepressant for me, and I don't know enough about psychopharmacology in depth, but my understanding, they're not particularly helpful for people with bipolar disorder, um, usually at least not by themselves.
Yeah,
And so,
I would definitely agree with the latter half of that. It seems like they're sometimes used, and the classic board question is like it causes people into mania kind of thing. But I have seen them used many times in people with bipolar, but often, like you said, in conjunction with something
yeah,
else too.
by themselves, they
Most likely not.
like
Yeah.
nothing and at worst cause mania. So, but I
Mm.
respond to them. So then I go to the hospital. It's my first time
So you
volunteering.
did have like, oh wait, you went to the hospital as a volunteer or a patient? Excuse me.
No, voluntarily. Like,
Oh, okay,
yeah,
okay, because you did.
like I
And
went.
so,
Okay,
what caused you to choose to go into the hospital?
well, I was having pretty really like very very strong suicidal ideation. Like
Okay.
plan, didn't do it, didn't. But it was getting pretty close. And so I was admitted. I was there for about a week, and this still is really weird to me. Nothing was changed medication wise, absolutely
Hmm.
nothing. Which was except the day I was discharged, which
Okay.
was so weird. So I'm on 150 milligrams of sertraline for 6 days. Day 7, on the morning of, I'm told we'll go up to 200, and I was discharged later that day, which was just, I don't know. I think that's really weird, but that's what was done. And after that, I soon after that I decided to rent a new house, and like I went about $2,000 into credit card debt. I decided to re-enroll in school. I was going to get married to this guy that I
Hmm.
barely, like I was doing it like pretty manic based symptoms. So this was like a
Yeah.
period of over a couple of months. And then I ended up seeing a new psychiatrist because I was still seeing this. I only have one psychiatrist in my town. I live in the middle of nowhere in rural Illinois.
Okay.
We're very, very limited. And so the psychiatrist that I was seeing, he runs the pediatric, adult, geriatric floor, and he also has an outpatient clinic, and he also services the rehab center. And he does all three. We only have two psychiatrists for like 400,000 people in my
Yeah.
area. So
Yeah.
it's like my appointments with him were about 4 to 5 minutes. And I just,
Wait, 4 to 5? Like
yeah, like,
5?
like 5 max.
Oh wow.
Yeah,
Jeez.
it's really bad. And that's not to slight him. I think he really cares.
The
They're,
demand. Yeah. Yeah. Well, I'm glad we're both going into this field. Yeah.
yeah. And so, yeah, I have a place in my heart for, like, I really want to do rural medicine.
Okay.
Really want to do just because I feel for people that don't really have many options and are
Yeah.
given subpar care because there's so many people to service. So, and this guy, like, he's such a cool, he's like 80. He looks like he's going to drop dead
Yeah.
one day. He will like practice psychiatry till the day he dies.
So
Like,
he
he,
was doing the best he could with giving you these short appointments. And was he the one that diagnosed you then at that point?
no, he's the one, he's the one who discharged me on 200 milligrams a day. I was just like, this is not working out. So I started seeing a new psychiatrist. This is super weird. Telehealth. He lives in India. Okay. He passed away from COVID.
Oh
Which is
wow.
hard. Yeah. So he passed away from COVID. But I was put on lamotrigine,
Yep.
which can help with uh, the bipolar depression. It really did, but I don't think it really did too much overall, especially not with like, preventing more manic episodes. Lamotrigine is not very effective at that. Um, so that was helpful, but then I had 4 surgeries, like 4 major surgeries under general anesthesia the entire time for mostly gynecological issues. And so I think that would be stressful for anybody. I had 4
Yeah,
surgeries,
definitely.
6 months time. And that was like very, very difficult for me. And I was really, really depressed. And I was
Hmm.
like meltdowns at work. At the time I was working in the emergency room, and I was like, I seriously couldn't even make it through a shift. And my boss was like, I'm not mad at you. No one's mad at you, but you have to do something. Like you
Yeah.
can't keep freaking out. And I understood that. And so I went to a partial hospitalization program. I
Okay.
did about an hour a day to get there. So I did that. So it's like 5 hours of group therapy a day,
Hmm.
5 days, which was very helpful. I did that program for about 4 weeks or so. And that is when I got the diagnosis of um, I read the notes. She did not put bipolar disorder. She broached it with me in conversation and was like, I think it's very likely that this is what you have. At the time I was having borderline psychotic thoughts, but like psychotic thoughts with depression. And that's what she put it in. She coded it as was like depression with psychosis, and a host of other things. But basically, a lot of it I think was to appease insurance.
Hmm.
Yeah, so that's when. And then I got set up with an outpatient psychiatrist who's like, okay, this is definitely. So he specializes in sports psychiatry and was able to, I think, more definitively parse out um, some of the issues that I've had with like sports. It's always been about when I start working out really hard, I'm like amped. You
Yeah.
know what I mean? Like I am like ready to go. Like I don't need to sleep. Like I feel just like you know, that's usually like a precursor to it for me is like athletically.
Okay.
So yeah, that's kind of how I got to the diagnosis. So it's kind of all there from like age 20 to 25. However, I'm 26. The issue that I have is like it's still, and this kind of ties in with my career choice, is like something that I feel that I beat myself up about all the time, and that I've I'm very flattered that I've had coworkers tell me, like physicians tell me, like you should be a physician, you should go to medical school. Like I'm incredibly flattered by that. But and I beat myself up about it all the time, like that I'm choosing the easy route, I'm not meeting my potential, and blah blah blah. But I really don't feel able at this point in time in my life to try to do medical school. I think the first 2 years would be doable. However, I really worry about how I would react in the latter half, where your rotations are, your schedule gets a bit more haywire. And I really worry about residency. And the thing is like I'm still figuring this out. I actually just started a new medication like today. Like I'm
Okay.
still, you know what I mean? Like I don't have faith or a, you know, an ability to feel like I've really got it. And I feel like medical school is a huge thing to take on. And I feel like that's not something I should just blindly be like, I can work hard. Like, you know what I
Well,
mean?
so I'm a little, are you in a nurse practitioner program? I guess I'm confused at what stage of training.
Yeah. So an entry level MSN program.
Okay. Okay. And you'd graduate and already be the NP, or the NP is you do something after that again?
So, because I did not do my bachelor's in nursing, so you get your MSN, you can do the post master's certificate. So you don't have to do a whole nother program. You basically are just there one more year to become the nurse practitioner. Without that, you are just a registered nurse at the master's level. But obviously, it's basically for people that want to be a nurse practitioner, aren't really interested in being a nurse, but want to utilize the nursing model of education to become a provider. Is basically set up a lot like PA school. However, I would like to get my doctorate just because I would like to teach. So, but that,
Well, I mean, going back to what you said, I mean, first off, I don't think the goal is ever to have your shit all the way together with bipolar disorder kind of thing. I certainly don't have my shit all the way together. And, when I was sort of more in your shoes, 26 years old, knowing that I wanted to pursue this field, quite frankly, I was pursuing both becoming a psychiatrist or a psychiatric nurse practitioner. Because in my eyes, I think they basically do the same thing. There's basically every single drug a psych NP can do. There's a few things like electroconvulsion therapy. I
Yeah.
don't think a psych NP does.
No.
So I mean, but a handful of things, and that's I want to see that done more often, but that's a different subject. But um, I mean, so my answer is I think you should just kind of pursue both. Why not? And it's a little bit more training to become a psychiatrist. And you can maybe be in a little bit more of a leadership role in some capacity. But I'm playing devil's advocate. You can open your own practice as a psych NP and do your own thing that's basically identical to what a psychiatrist is going to do, depending on the
Yeah.
state. So I really just think it comes down to pursuing both. And it's I think they're both paths are hard in their own ways.
Yeah.
And I have those same concerns. Like, I haven't started residency. I actually just applied as of um like
Yeah. Wasn't
2 days
the you
ago or something.
now?
um yeah, and we can have a little celebration literally right before this email, right before this podcast. I got an email with my first residency interview, so that was pretty fucking cool. I
Exciting.
was pretty stoked. Yeah. But I mean, I think in your shoes, it's like, why not pursue both? If you're working really hard on learning all these science stuff, if you take the MCAT and you have the chops for it, I don't see there's any reason why you couldn't do it. But I also think pursuing psych NP is another fantastic route, and you can do amazing things with that I was willing to do that career path as well. I mean, I think it's a wonderful career path. But I definitely think you could do medical school,
Yeah.
um, but the reason I say this is because I've seen medical school break anybody. Medical school is terrible. It's super, super hard. It's way harder than it needs to be, but it can break someone like me or you who has a legitimate mental health diagnosed disorder that we take medication for. But it also can break people who have never had any sort of psychiatric issues ever, never taken any psych meds ever. And I've had friends had to leave for health reasons because of it.
Yeah.
On both sides of that equation, so there's no reason in my eyes why you wouldn't be able to do it.
Yeah. The thing that I worry about is like the routine. I really, really, really feel like I need to wake up at the same time every day and go to bed at the same time every day. It doesn't really go well for me if I don't do those things, and that's
Yeah.
the and I feel like I'm just letting that be an excuse, but I mean, I think that's something that most people with bipolar disorder need, maybe some more than others, but for me, that's like a huge, huge thing. And that's something that I know would be likely compromised in residency.
Yeah.
Um, yeah. And then the other thing, um, I have not ruled out ever going to med school. I just know that at this time in my life, I feel like I can handle doing an MSN. Like I feel like I can do that. It's still very hard. It's just the schedule and the intensity is not of which I'm sure medical school would be at that pace and that intensity. And I think part of it maybe is just that I'm, 5 years younger than you, and I just don't feel as confident in my ability to really like keep it together. Like I've gone about 10 months without having an episode, and that's about the longest I've ever gone. So for me, I just don't feel confident. And I like to think that it's a sign of maturity for me to be very discerning with that and not just decide like gusto will do it by itself to go to medical school. So I don't rule it out. I can always just get my MSN, and at the end, if I feel like okay, you know what, I want to take the MCAT, and I can go to med school. Like I'll be 29 or 30. Like it's still very
Well,
doable.
and there's no wrong path. They're both excellent, wonderful paths. Because at the end of the day, both of our goals are just to provide better patient care, and either path.
It's the same job, Sarah.
Yeah.
I mean,
And one thing, it's definitely a big concern for me too. Am I going to be able to handle the crazy sleep demands that residency is going to require of me? And thankfully, psych residency is much less intense than like a surgery residency, like some of my friends are pursuing. But one thing you actually mentioned that I wanted to sort of talk to you about is just like this concept of exercise. Because for me, I certainly have a lot of hypomania feelings sometimes, but for me, exercise is actually my method of treatment. That seems to work sometimes the best. If I start to feel that manic kind of energy, if I go exercise really hard, harder than I normally would, and do one of those intense days, I for sure get a good night's sleep. And that's how I manage my sleep schedule. Because for me, just like you said, um, you know, if I manage my sleep, I normally do pretty good about managing my bipolar disorder.
yeah,
And like I wear one of those eye masks, and I make sure the room's really dark, and I try to be good about my sleep hygiene. But exercise is one of those great treatment modalities for my insomnia. So to hear you basically be on the opposite side of that, that it's almost a trigger for your insomnia, it's that must be incredibly challenging. So what techniques have you developed to help out with your insomnia when you do get those kind of hypomanic feelings?
yeah. Interesting. Okay, so um, there's a study, narrative review of bipolar and psychotic disorders in elite athletes, put out by Dr. Claudia Reardon. She is like the queen of sports psychiatry. She works at University of Wisconsin. I'm actually writing a paper with her right now,
Wonderful.
co-author something together. But she put that study out with a couple other researchers about a year ago, so very fresh. And it's really the only study, or it's a literature review, but it's the only literature review that looks at studies of exercise. It's the only one in this depth that's really analyzed a lot of material, which is not much to begin with, about exercise, athletes, bipolar disorder, psychotic disorders. Basically, they found that, what was it, swimming, running, walking, biking, cyclic, I think they even said cyclic and rhythmic exercise was very beneficial for people with bipolar disorder. But what wasn't was like extreme sports, stuff where it's like a lot of risk taking, like, I don't know, motocross or skiing or something like that. And then very like high intensity, like, like sprinting, basketball, things where I mean, if you look at like someone's brain waves and what's going on in their head when they're just swimming along versus like, okay, I'm gonna, run up and down the court and jump really hard and for 30 seconds, and it's so different. And like, she's so awesome. She's like my idol. She's probably put out like 60 papers. She teaches at the University of Wisconsin-Madison. But I have found that to be very true for me. If I just, like I said, as a distance runner, I can run easy miles. Like a 15-mile run, like that'll actually leave me pretty tired, and like I'll be fine. But if I'm doing, like yesterday, I did 4 by 1,200 meters, so that's 3/4 of a mile, like at hard effort, like at race effort, and that just leaves me totally amped. And so the way that I have found to combat this, to answer your question more specifically, it's kind of tricky. So I take quetiapine,
Mm-hmm.
so well, I take 150 milligrams a night. So I actually don't find it to be troublesome to run. I actually, if I'm going to run really hard, though, if I'm going to do a workout, it's not going to be in the morning. I mean, the
Mm-hmm.
half-life is, I think it's 6 hours, I think.
Oh,
Um,
I don't remember off the top of my head. I have no idea.
I remember all this weird stuff. I think it's 6 hours. But I mean, I still feel like I can run in the morning, but I'm not going to run hard. First of all, my chronotype, I am not a morning person to begin with. Second of all, it's kind of hard to like go all out after taking, an antipsychotic, 8 hours before or whatever. So I run in the evening. So it's kind of a double-edged sword. Like, okay, well, I feel like I can run harder in the evening because more of the quetiapine's out of my system. And I'm also, I know my chronotype is I'm a night owl. But the problem is that it, I'm a little more amped into the evening then. And so as a runner, most runners do about 2 hard workouts a week. So there's usually like 2 days a week where there's something really hard that I'm doing that kind of gets me like really amped, that has historically been, troublesome for my manic symptoms. And so what my psychiatrist and I have done is add 50 milligrams of quetiapine exclusively the nights after I do these really hard workouts.
Interesting. Okay.
Oh yeah, it's something that we're want to put out in the paper, like cyclical dosing for that scenario. Because if not,
Mhm.
um, I it just I just get to a point where I'm not sleep. Like I always know, like he's like, okay, the first sign of, because it's hard. It's like for someone like you and I, like all the symptoms of a manic episode, and like I feel like, I should be able to like totally recognize it right away, but I don't always haven't always been able to recognize it right away when I feel like I should. And always like the sleep is like the number one sign. He's like, if you can't
Yeah.
sleep for 2 nights, or you have to like call the office. That's always like the kind of my early warning signal. But the cyclical dosing I have found to be very helpful.
Yeah, and I would be interested in reading that paper you referred to because, for me, I've recently gotten to kind of distance cycling and doing, like 30, 40-mile rides, like really enjoying that. And that's a different sort of workout for me because I never was an endurance kind of person. But I really like it, and I like kind of that mental solitude of just being out there. Um,
But yeah,
but
that's
what I've found,
helpful for bipolar disorder.
yeah, but I would want to know how her research has shown that it's more beneficial than other types of workouts because I feel when I do those long workouts, my brain is still sort of thinking about things in my life, maybe processing them, but sometimes worries even and future planning. Whereas when I'm playing basketball or skiing, I'm in such a more deep flow state of mind, I feel, where I'm so in tune with that moment because
Yeah.
I think quite frankly I'm enjoying it more than cycling. At least certain, bombing down a huge hill on a bicycle going 40 miles an hour is that's another one where you are only tuned in on that moment. And that for me is where really I really get some of the most mental benefits I think from exercise. And one thing I also wanted to kind of talk to you about while we're on this subject is I've found that combining my bipolar disorder with exercise kind of creates these very amazing creative state of mind. And this podcast was actually, I thought of it in the middle of an exercise, like I should start a podcast. So it was while I was listening to podcasts, and I feel like I don't know, and I think I quite frankly need to improve my understanding of brain science, but I know there is something there. Like obviously we know creativity is improved with exercise, improved blood flow, focus maybe. But yeah, that's been my experience.
I remember reading a paper, and I do not remember the name of it. I would have to dig it up. They have found that I did exercise science in undergrad. That's what I did my undergrad degree in. I remember like my professor like coming in one day telling us about, if you do exercise and then you study, like 30 minutes of exercise, and then you study, people retain the knowledge much, much better than they did. And they actually retained it better with sports like basketball, and I think it was like lacrosse and soccer, versus a rhythmic sport. So I think it kind of matches what you're saying. I think it's just because you're really sharpening the focus of what you're doing. So that's definitely true. I think it just depends for everybody. And I think the other thing to think about is, and this is not coming from like an arrogant place, but someone who's really, really fit, like me, I don't know how else to say that. Someone who's like a really fit athlete, physiologically, like their body is probably experiencing something like Like for me, like 8 miles or 8 miles at a certain pace is not stressful. So I think it's just like, it's totally dependent upon each person's like cardiovascular system. So I think it's totally, what's the word I'm looking for? Personalized. I can't think of
Yeah, just unique to each person.
yeah. So
Um,
I think each person's brain obviously is going to respond differently.
so kind of last kind of real big topic I want us to talk about here is, so you've been diagnosed with bipolar about a year now
Mhm.
ish, right? So what is your attitude around kind of disclosure? Just like, you've shared some stuff on Instagram, which I've seen, which is really cool. If people want to follow you, it's at Sports and Psych. Make sure you check that out. But how have you viewed disclosure? Who have you really disclosed to? And do you plan on disclosing to um, admissions committees when you apply to nursing or medical school, or your future patients?
That's a tough one. I still have not been fully, um, I'm really scared about ever disclose, like right now, it's hard for me to decide, am I going to disclose this to an employer? Am I going to disclose this to, a admissions committee? In my personal life, it's very easy. My friends know, my family knows. Obviously, I broadcast it on social media. Um, However, do I, like, for instance, like I just got a new job. And before I did my new job, I put everything on private on my Instagram. That's the only social media account that I like post that to.
Mm-hmm.
And so I always set it to private if I'm ever like applying for anything. Um, I did get a new job recently, and it was I got the job, and I'm actually working at a chiropractor's office, which is very
Okay.
interesting. And I I've been doing like we get like free acupuncture treatments or whatever. So I was like, okay, let me try it out. And we had to put all this stuff, and I'm thinking like about your medical history and blah blah blah. And at first I was like really embarrassed because like, okay, now my boss is gonna know that I take like an antipsychotic. Like she's gonna think like, oh my god, who did I hire? But I decided no, I'm gonna do it. So like my boss knows. So that was like a big step for me, is like my knowing that my boss knows that, you know. And I was asking her about, she specializes in like women's like fertility libido issues, and I was talking with her about that, and she's like, well, anyway, so I had to disclose that information to her, and it actually wasn't bad or scary, and she didn't, it was fine, you know,
Mm-hmm.
no big deal. It wasn't as big and scary as I thought it was going to be. um and in regards to future patients, that's tough because I've heard everybody say that it's inappropriate, you should not do it. But I feel like with the right patient in the right context, I feel like it could be really helpful. Um, I don't see why that would be a bad thing. Um, I mean, I trying to think of the psychiatrists that I've seen. I mean, they won't say, no one, because I have no idea if they have any problems, but they'll empathize with symptoms I'm having. They're like, well, I get really anxious too, or I get, they don't come out and say like I have this diagnosis too, but at the minimum, I think mirroring that, hey, like I feel that way too, but I feel like to say, you know what, I have this disorder as well. I feel like that could be a really powerful way of connection with a patient,
Mm-hmm.
when
Mm-hmm.
appropriate, obviously. But what are your
Yeah.
thoughts?
It's I'm gonna take the scientist route and cop out and just say it's both. I think it can have a powerful effect, both good and bad. I think you can create a wonderful connection between the patient and the provider, but it can definitely also backfire. And I've personally some one time disclosed to this one patient, and he ended up not being diagnosed with bipolar but schizophrenia. And I thought about retrospectively, like, was he disappointed that he didn't get the same bipolar diagnosis that I had got?
Yeah,
Here's this medical student with bipolar disorder. Oh, I have schizophrenia now. Is that totally different? Can I not do something like that person did because I had bipolar disorder? And so it was a great teaching moment for me. And I certainly don't have a easy answer to this one, and it's going to be something that's going to continuously evolve and change over time, and hopefully I get better about learning how and when to properly disclose. Then on the other side of the coin, it's 2020. I choose to not be really private about that aspect of my life. And I post on social media about it, YouTube, this podcast, and so people are going to find out. And so I think eventually at one point in my career, it's patients will probably already know before they even talk to me. And that's
Yeah.
just something I'm going to have to deal with. It's something that I created, and maybe I'm going to be self-selecting for certain patients. Hopefully that's a good thing. Hopefully it'll be patients that actually believe that I'm not inept or not smart enough, unstable, or whatever. And people are definitely going to have those attitudes, and I think also if you accept that that's going to happen occasionally throughout this path of disclosing your mental illness, I think it's much easier when you finally do hit those kind of bullshit stigma moments. But
Yeah.
they really are far and few between. It's only happened to me a handful of times, and it's the more you disclose, I think the easier it is to kind of deal with, and that's kind of been my experience thus far.
Well, it's hard because no one really talks about it even in this context of like, well, hypothetically, would you? Like,
Hmm.
I feel like there's not even really those kind of discussions. Have you? There was a recent season, I think, just in the last season of Grey's Anatomy. I don't know if you're a Grey's Anatomy fan, but one thing I really didn't like was, are you aware of this at all? Of the Grey's Anatomy bipolar
I'm
thing?
not. I've certainly seen some episodes and stuff, but not this newest
Okay.
season that you're referring to.
Huge fan of Grey's Anatomy. And in one of the most recent episodes, one of the main character's dads, who's a physician, has bipolar disorder, and he's from Italy. And he is like lost his license or something in Italy, and because he had a manic episode and he was like endangering patients. And then his son, who's one of the residents on the TV show here in America, starts to show symptoms of mania, and he becomes dangerous to the patients. And I'm just like, what? Like, really? Like, are we really going to show it in that context? And I mean, it is a surgical residency, maybe where there's, more potential for danger, but like people who are manic, I mean, of course, you have to be, you know, I think as any healthcare provider, whether you're like a radiology tech or a nursing assistant or a physician or a surgeon, you always have to be, aware of how that's going to impact other people. But I felt like, come on, like you could have shown that context in a much better way. I feel like that's further stigmatizing that people who have this mental illness can't be trusted as healthcare providers. They're dangerous. You always I was very annoyed by that, and I'm a huge fan of the show, but I just thought
Hmm.
the very
Well, I
little.
feel like adding bipolar disorder is like a hot buzz way to thicken any plot right now. And so
Yeah.
my wife always laughs because we'll be watching any random show. We were watching this murder mystery last night, and they just randomly threw in that the character's bipolar, and I'm just always like, of course, like they always make it just so it's that much more exciting and thick and interesting, and it just. I mean, there's of course dangers to I guess having a surgeon with bipolar disorder, having any physician with bipolar disorder. I get that and I accept that, and I know that being publicly open about all this, I'm probably gonna have to jump through additional hoops, which is annoying. But things aren't going to change unless people are willing to kind of maybe take this kind of path. And I'm really glad that you're making similar decisions to me. Whether you end up as a nurse practitioner or a psychiatrist, it doesn't really matter. We're going to be doing essentially the same thing, and impacting patients in a positive way. And so I'm really glad you're open about your issues, and I think it's super interesting, kind of your appreciation for like the exercise physiology and how that impacts kind of mental health. We're coming up on almost an hour here. Is there anything else, Sarah, you want to share kind of about your story or chat about before I take up too much of your Wednesday evening here?
Um, No, I think that pretty much sums it up. Interestingly, I think I don't remember the name. It's a physician. I think he's somewhere in California, resident. He has bipolar disorder. It was like an article in the Washington Post that was put out pretty recently. I don't remember his name, but he also, has made publicly. He, is a psychiatry resident with bipolar disorder. And actually, I think it was like year 2 of his residency or something. He actually had to go to the hospital and be hospitalized. I think he was in there for like a month, like he was not doing well. He came out with all this publicly. And I mean, I think it's so brave of him to share that. But it's like, I always wonder, because that was such a great story to share, but it's like I always wonder, like, how many people are actually having that experience. Like, why, it has to be like if somebody has a seizure disorder, or they have cancer, or they have whatever else in medicine, or when they're in their training, or when they're in residency, it's like, no one bats an eye if they have cancer and they have to, have special accommodations, or leave, or but it's like it's the same thing with bipolar disorder. I feel like it should be, or any psychiatric disorder.
Hmm. Yeah, yeah, I try to stay hopeful, and I try to, it seems like our generation is just so much more able to discuss these things and feel more comfortable about any sort of accommodations, or just trying to improve the system, because I mean, there's, of course, it seems like so many people who just work in healthcare don't like it. And that's just so sad, because we need more healthcare workers. And it's such a bummer. But I'm glad people like me and you are going into it. I've only had a chance to talk to you for about an hour now, but I already have the utmost confidence you'll make a great provider, one day.
I don't know. I hope.
Oh, you will. You will. You will. Absolutely. Well, it's for the listeners out there. I hope you follow Sarah at Sports and Psych on Instagram. She makes some really cool kind of posts about just kind of like your experience. And you reached out to me about coming on. And I definitely want to have you on again. And it would be cool to kind of follow your career path and journey, however it may end up. And yeah, it's been a pleasure talking with you this afternoon.
I hope that your applications go well, and that you got an invite for an interview, right?
I have one interview as of this morning, so I'm super, super stoked. Yeah, I just submitted, man, it feels like way too many residency applications, or on Monday, and I'll be interviewing via Zoom like this for the next 3 months, and then come March 2021 is good old match day, where I'll find out where I'll work for the next 4 years, hopefully. So
Yeah.
that's where I'm at as a fourth year med student. Yeah.
Okay. Well, it was so nice meeting you. I really enjoyed this, so I hope it brings something good to somebody somewhere.
It definitely will. It definitely will.
Okay.
All right, Rad, take it easy.
Okay. Bye.
Bye.